And our last topic will be choking. Early recognition of foreign body airway obstruction is the key to successful outcome. It is important to distinguish this emergency from fainting, heart attack, stroke, seizure, or other conditions that may cause sudden respiratory distress but require different treatment. Foreign bodies may cause a range of symptoms from mild to severe airway obstruction. During mild obstruction, we have good air exchange, coughing, and wheezing between coughs. We need to encourage and continue coughing and do not interfere with the victim's own attempts to relieve the obstruction. During severe obstruction, we can observe clutching the throat with the thumb and fingers, universal choking sign. Unable to speak or cry, poor or no air exchange, weak, ineffective cough or no cough at all. High-pitched noise while inhaling or no noise at all. Increased respiratory difficulty and possible cyanosis, blue lips or skin. During severe obstruction, ask, "Are you choking?" If they nod, yes, they are not speaking, they are nodding. Take steps immediately to relieve the obstruction. If they are unresponsive, what should we do? We need to start CPR, then leave to activate the emergency response system. Choking relief in a responsive adult or child. Use abdominal thrusts to relieve choking in a responsive adult or child. Do not use abdominal thrusts to relieve choking in an infant. Give each individual thrust with the intention of relieving the obstruction. It may be necessary to repeat the thrust several times to clear the airway. Abdominal thrusts with the victim standing or sitting. Follow these steps. Stand or kneel behind the victim and wrap your arms around the victim's waist. Make a fist with one hand. Place the thumb side of your fist against the victim's abdomen, in the midline, slightly above the navel and well below the breastbone. Grasp your fist with your other hand and press your fist into the victim's abdomen with a quick, forceful upward thrust. Repeat thrusts until the object is expelled from the airway or the victim becomes unresponsive. Give each new thrust with a separate, distinct movement to relieve the obstruction. A choking victim condition may worsen and the victim may become unresponsive. If you are aware that a foreign body airway obstruction is causing the victim's condition, you will know to look for a foreign body in the throat. Follow these steps. Shout for help. If someone else is available, send that person to activate the emergency response system. Gently lower the victim to the ground if you see that they are becoming unresponsive. Begin CPR, starting with chest compressions. Do not check for a pulse. Each time you open the airway to give breaths, open the victim's mouth wide, look for the object. This is very important and remember this for test. If you see an object that looks easy to remove, remove it with your fingers. If you do not see an object, continue CPR. After about 5 cycles or 2 minutes of CPR, activate the emergency response system if someone has not already done so. If a choking victim is already unresponsive when you arrive, you probably will not know if a foreign body airway obstruction exists. In this situation, you should activate the emergency response system and start high-quality CPR. When a choking victim loses consciousness, the muscle in the throat may relax. This can change the complete severe airway obstruction to a partial obstruction. In addition, chest compression may create at least as much force as abdominal thrusts, so they may help expel the object. Giving 30 compressions and then removing any object that's visible in the mouth may allow you to eventually give effective breaths. You will know you successfully removed an airway obstruction in an unresponsive victim if you saw and removed a foreign body from the victim's mouth and the victim starts to breathe. However, you don't always have to remove the foreign body to successfully relieve the obstruction. If you can feel air movement and see the chest rise when you give breaths, the airway is no longer obstructed. After you relieve choking in an unresponsive victim, proceed as you would with any unresponsive victim. Check again for responsiveness, check for breathing and a pulse, confirm that someone has activated the emergency response system, and provide high-quality CPR or rescue breathing as needed. And encourage a responsive victim to seek immediate medical attention. If the victim is pregnant or obese, perform chest thrusts instead of abdominal thrusts. Now, choking relief in responsive infants. Use back slaps and chest thrusts for choking relief in an infant and do not use abdominal thrusts. Follow these steps. Kneel or sit with the infant in your lap. Hold the infant face down with the head slightly lower than the chest, resting on your forearm, as you can see in the image. Support the infant's head and jaw with your hand. Take care to avoid compressing the soft tissue of the infant's throat. Rest your forearm on your lap or thigh to support the infant. With the heel of your hand, deliver up to 5 forceful back slaps between the infant's shoulder blades. Deliver each slap with enough force to attempt to dislodge the foreign body. After delivering up to 5 back slaps, place your free hand on the infant's back, supporting the back of the infant's head with the palm of your hand. With the palm of one hand, support the face and the jaw while the palm of the other hand supports the back of the infant's head. Turn the infant over while carefully supporting the head and neck. Hold the infant face up, with your forearm resting on your thigh. Keep the infant's head lower than the trunk. Provide up to 5 quick downward chest thrusts. In the middle of the chest, over the lower half of the breastbone, the same location as for chest compression during CPR. Deliver chest thrusts at a rate of about 1 per second, each with the intention of creating enough force to dislodge the foreign body. Repeat the sequence of up to 5 back slaps and up to 5 chest thrusts until your actions have removed the object or the infant becomes unresponsive. If the infant becomes unresponsive, first shout for help. If someone responds, send that person to activate the emergency response system. Place infant on a firm, flat surface. Begin CPR, starting with compressions with one extra step. Each time you open the airway, look for the object in the back of the throat. If you see an object and can easily remove it, remove it. Note that you do not need to check for a pulse before beginning CPR. After about 2 minutes of CPR, activate the emergency response system if no one had done so. One important thing, do not perform a blind finger sweep because it may push the foreign body back into the airway, causing further obstruction or injury. And in this slide, this is me after putting together this presentation and you, the brave ones who survived it.